Hello, everyone, and welcome to this Brocher Foundation Meetup. I am Sally Davies, Executive Editor of Aeon magazine, and it's my pleasure to host the discussion today on the ethics of human subject research. From the use of placebo controls in clinical trials to the exploitation of vulnerable populations, the history of research using human subjects is marked by both groundbreaking discoveries and egregious human rights violations. Today, as we stand at the frontier of new technologies from gene editing to artificial intelligence, the ethical challenges only grow more complex and urgent. So in this context, we're going to hear from our panelists who bring diverse perspectives and experiences from their work in China and the United States, spanning fields including bioethics, law, and anthropology. So before I ask our panelists to introduce ourselves, I'll just do a quick piece of housekeeping. The meetup is going to last approximately an hour. In the first half hour or so, we're going to hear some brief presentations from our panelists. And then in the last half hour, we're going to open up the floor for discussion. So please do feel free to drop some questions in the Q&A, and either myself or the panelists will be able to pick them up. So just to begin, I'm going to ask our panelists to introduce themselves. Brietta, would you like to kick off?
Hi, my name is Bree Clark, and I've been a professor of healthcare law at LMU, Loyola Law School in Los Angeles for about 20-some years, currently serving as the dean as well.
Thank you so much. Shana, would you like to take over?
Yes. Hi, everybody. My name is Shana Harris. I'm an associate professor in the Department of Anthropology at the University of Central Florida in Orlando, Florida, in the United States. And I also have a sort of joint appointment with our Department of Internal Medicine at our College of Medicine. And I'm an anthropologist. I've been at UCF now. I think this is my 8th year or so. So I'm not quite as well versed as Bree in her position. But yes, thank you so much, everybody, for coming today.
Thank you so much. And Haihong.
Thank you. Good evening from China. I'm Haihong from Peking University. So I work as the Human Research Protection Program. So I was trained as a bioethicist, and I work in our Institutional Ethics Review Board. So it's my great honor to be here.
Thank you so much. So we're going to kick off the presentations today with Bree. I'll hand over to you now.
Thank you so much. So I come to this research and this topic, as I mentioned, as somebody who's focused a lot on healthcare law. And I also have experience with in what we call an institutional review board, which is the body that is responsible for reviewing research proposals on human research subjects. So I've been able to kind of have that view as well. And with anything, I'm always asking the question about what law should do, what it can do, and how well it's accomplishing the goals it says it has. So in this context, I've looked at and am also part of a casebook that looks at a survey of healthcare law, including the law that governs protections for human research subjects in the US. And this has evolved over time. Happy to talk more about that in Q&A. We had our first federal law in 1974 that created kind of certain bodies to look at this, certain principles. This has evolved over time. And our modern regulations really came into being in their robust form in about 1991. And I want to share my screen just to highlight a couple of things about this. Okay, are folks, let's see, are folks able to see the screen? Okay, great, perfect. So again, there's so many different pieces of this that we can talk about that I'm happy to explore in Q&A, to delve more into the substance, talk more about examples, talk about enforcement, and the various laws that exist even beyond what I'm going to focus on, which is our kind of modern set of regulations that are federal regulations that apply to federally funded research, but practically actually go beyond that, and that create kind of both a framework, they're supposed to embody certain principles of biomedical ethics that really, we hope, govern our healthcare practice as well as healthcare research, but are certainly critical for research on human subjects. And those principles are on the left side of the screen: principles of autonomy, beneficence, non-maleficence, and justice. So, of course, I'm sure to this group and folks who are here, these are very familiar. What we call the common rule are a set of regulations that are designed to put these principles into action by requiring that any proposal in human research subjects have certain protections in place. So to even get the approval that is necessary by the requisite bodies, like the Institutional Review Board I mentioned earlier, we call IRB for short, there are certain things that this IRB looks for in any proposal to ensure protections. And they roughly, right, are designed to correspond to the various big principles that I just highlighted. Informed consent, for example, is very much designed to protect autonomy, right? An individual's ability to decide in an informed way whether or not to engage in a research project. Kind of the rules insist on kind of settings that encourage voluntariness, make sure that truthful information is given, and make sure that there's full information that we think anyone would want to be able to make a meaningful decision about whether to participate or not, including risks and benefits. And so this is relevant both to autonomy and this idea of, kind of beneficence and non-maleficence. Risks should be minimized, and to the extent there are risks, they should be reasonable in relation to any benefits that we anticipate. And we make distinctions, important distinctions, between benefits to the individual as well as benefits that we hope kind of general knowledge to be gained. Justice, right? We are very concerned about abuses that we have seen in our system to date. Indeed, many of these regulations were in response to pretty horrible abuses, again, that I can talk about in the US, around the world. And so there are non-discrimination provisions, but also additional safeguards for vulnerable subjects or communities. And then there are additional safeguards for confidentiality and privacy, which again are kind of designed to address a few of these principles. I just want to highlight quickly that one of the big challenges, however, is that the rules that exist today are pretty limited. They seem designed to really avoid the worst abuses of the past. They're designed to avoid the worst abuses of the past, to make sure that we are not denying people the ability to make choice at a very rudimentary level, but we haven't gone as far as we could to really try to make sure that we are ensuring kind of maximum agency for groups, that we are truly kind of understanding and thinking about equity as we think about where research projects are being done, who they're targeting, who's benefiting at the end of the day from the burdens that particular groups are bearing in these research projects. And I have this slide up because basically it's important to remember that any research that's done is done within the reality of the systems that exist already. So to the extent there is profound inequity, right, that has already been created around certain groups' ability to access healthcare and their ability to exert a certain level of agency, right, that is going to be part of whatever, kind of research system is overlaid. And one of the things that we are trying to do, I was asked to kind of articulate what are the deep questions we should be asking about in the research context. And one of them is to really ask this question: beyond the protections we see on paper, if we take seriously the idea of justice and truly wanting to make sure any benefits and burdens of research are being borne equally, and we really want to take the idea of true equity as a goal, not just kind of non-discrimination at a very basic point, and even autonomy. Right now, much of our idea of autonomy is let's give people as much information as possible so they can say they had all of the information. but very little attention is actually paid to whether people understand the information that is given to them and whether or not their larger context in which they live enables them to truly make informed choices. This is something that, kind of in the US, we are paying a lot more attention to, I would say, now than we have in the past, not just for research, but also for healthcare access broadly. So these are some of the principles I can talk a lot more about in Q&A. And the other slides I have are just some examples of some of the challenges we've seen with research recently, where despite these protections being in place for many decades, we still see a mistrust in certain communities of research that is being done, including at critical moments of public health, like the COVID pandemic, where we absolutely needed that trust, and we wanted to help people get access to important new innovations and drugs. So sorry, I went over a little bit there, but thank you so much for indulging me.
Fascinating. Thank you so much, Brianna. And I know we'll come back to lots of these questions in the conversation. I'll hand over to you now, Shana, to talk a bit about your research.
Okay, thank you. I'll also share my screen. And is that good? Can everybody see that? Perfect. And that's better. Excellent. One thing, thank you so much, Bree, for some of that background. It really helps contextualize some of the things I want to talk about. So as I said, I'm an anthropologist. I'm a cultural and medical anthropologist, and my research focuses primarily on drug use and anything really related to drug use, whether that's problematic drug use or recreational use, drug treatment, harm reduction, drug policy, risk for HIV, hepatitis C, anything like that. And so my research as an anthropologist is primarily in the US and Latin America. And I'm a qualitative researcher, especially I do ethnography. And although I have been involved in a lot of projects that do have qualitative methods or quantitative methods, excuse me, my research as an anthropologist and my real knowledge and passion is in qualitative research. And because of what I study and the kinds of methods that I employ, I've had some challenges related to research ethics. And Bree brought up a couple of them, which I think are really great and definitely intersect with some of the challenges that that I've faced. The first one, oh, sorry, that did not do as I was supposed to do, but I'll just leave them right here. With all research, there's challenges, but one thing that I have had an issue with over the years, and certainly in different institutions that I've been a part of, is that qualitative research methods are not necessarily well known by people who are reviewing your human subjects ethics applications. I've had varying levels of success, and they tend to know interviews. However, a big method that I use is called participant observation, where I'm observing people, but I'm participating at the same time. It's not what I think a lot of people think of, which is, I'm behind a glass wall and I'm watching people doing things. There's an interactive element to it. But a lot of the IRB reviewers don't seem to quite understand some of these methods that I use, that my colleagues use, that my students use. And a lot of times we are left either having to sometimes change our research protocols just to meet what they want, or we have to really almost educate them about what these methods are. And they're not fringe methods. They're quite common to a lot of fields. And so a challenge that I've just had is having to work with the IRB to varying degrees of frustration of trying to explain that the research and the methods that I'm using are ethical, they're well known, and they're appropriate to answer my research questions. The second issue is the fact that because I study drug use, I'm studying illegal activity. And as somebody who does study that, there are certain ethical challenges and ethical considerations that I have to think about when I'm not only working on my IRB applications, but throughout the entire research process. At my university, we do have in our IRB application an area where it says, are you doing research on illegal activity? And you click that, and you have to answer certain questions, but that is not standard across all IRBs. In fact, about 2 weeks ago, I spoke with a PhD student at a different university in the United States who is doing research on drug use, and they have nothing like that in their IRB or applications. And that has been a challenge for them to try to get their IRB to allow them to do research on illegal activity. And then with that comes the issue or challenge of working with vulnerable populations. And I have this in quotation marks because, as Bree very nicely laid out, our IRB in the United States requires you to indicate if you're working with federally recognized vulnerable populations like children, people who are under 18 years old, pregnant women, or people who are incarcerated. And then there are these, as she was saying, these additional safeguards that aren't very clear sometimes, but are there to work with groups that are vulnerable, perhaps to coercion or undue influence. So people who might have impaired decision-making or be economically or educationally disadvantaged. But one of the things that I have to also focus on is that as people who are engaging in usually an illegal activity, or people who might be in vulnerable situations because of economics or because of the kinds of, if they're unhoused or if they are marginalized in other ways. I'm also working with vulnerable populations that don't necessarily fit the criteria of what the IRB claims to be vulnerable. And then the final one, which is a much broader issue, which I'm, of course, happy to talk more about, is that I often come across this issue of formal versus informal ethics. Bree, very nicely called what I interpreted formal ethics to be like protections on paper, which we do have to always have. And there is a role, a purpose for these kinds of formal protections. However, there are ethics that, at least in my discipline or personal research ethics, that I have to follow that I feel are more informal, not institutional, in that there are issues that have to do with how do we share our data? Who do we share it with? What are our responsibilities to the communities where we do the research? Are there certain things that come up over the course of my field work that the IRB never really asked about, but at the same time, I have to address them in the course of my research? And so this formal versus informal ethics that come up a lot with me and my students who work around the topics that we research, that we have to grapple with a lot. And so those are just a couple of the things that relate to my research, and I'm happy to talk more about any of these or any questions that people may have.
Thank you, Shana. That's great. And we'll definitely come back to some of these fascinating subjects. I'll just end this section by passing over to you, Haihong, if you'd like to introduce your research.
Thank you, Sandy, and it's my great honor. So also many thanks are due to Shana and Bree for the great presentation. So for my side, I would like briefly give a quick glance of the latest update of the ethics review of our Chinese ethics review measures. And we know that the ethics review mechanism was set up in 1990s. It's about 30 years of effort. However, in last year, the ethics review measure of life science and medical research involving human subject was issued. That was the first time the 4 government agencies worked together to issue such kind of ethics review measures. And as previously in our 2016 version, hospitals are required to set up their institutional ethics review. However, according to the 23rd guideline or the 23rd requirement, not only hospitals, but also universities and research institutions are required to set up their institutional ethics committee. And we just make a comparison between the previous version and the latest version. We can see that 3 points were reaffirmed in the updated version, like institutions were identified as the main responsible for the management of ethics review of human subjects research, and informed consent and ethics review were endorsed by our regulatory system as two of the most important strategies. And also, we make sure to compliance with the international ethical principles, for instance, like the 3 basic ethical principles set forth by the Belmont report. However, more detailed updates were showed in the 23rd version, like universities, research institutions are required to set up institutional ethics committee. However, due to the resources or the other efforts needed, not every institution are required to must set up the ethics committee. The reliance mechanism is also acceptable. Some more tailored update is regarding the informed consent requirement. And for the past 30 days, 30 years time, it was the first time the exempt review of research categories were adopted in our policy, and another to increase the ethics review efficiency. The 30-day review timeline was set forth. Besides the general ethical principles, 6 basic requirements of the ethics review is illustrated. That include the risk control, the informed consent, the fair selection of the research participant, and the fair distribution of the risk and benefit, and also the cost, fees, and research-related injury compensation, along with the issue of the personal information protection law and human genetic resource administration requirement. The privacy and personal information protection was specifically strengthened in this new research ethics review measures. And also another point is particular protection for the vulnerable group. And I would like to mention here for some more practical perspective is regarding the details of the application materials and consent forms. Here on this slide, I highlighted blue as the special requirement for those research that involving use existing data or biospecimens, and the potential conflict of interest are required to disclosure in advance at the very beginning of the ethics review application. For the consent forms here, at least 3 newly ended points were reaffirmed in the new guideline. That also regarding the research data or personal data and the biospecimens, more details regarding when, who, how to collect such kind of data or specimens, for what purposes, and for future sharing or transfer of such kind of materials required the investigator or the research group to make good plan in advance. And another mechanism regarding the whole process management of the consent is 3 conditions for the re-consent requirement were set forth. Whether during the research implementation process, the research content was significantly changed or the research risk. And another issue is about the consent capacity change of the research participant. So I just give a very brief and quick overview of the update of the latest ethics review requirement. However, from the practical perspective or as ESCO review member perspective, we were making such kind of challenges like how to make high quality ethics review with efficiency, like just because we conduct ethics review at institutional level for those multi-center research or cooperative research, some might be unnecessarily duplicated. At the same time, there are a lot of requirements regarding informed consent. It will be very challenging for both ethics committee and the research community. However, besides the compliance requirement of seeking ethics review and getting informed consent, it is widely accepted that assure compliance is important. However, compliance is not enough. How can we working together to make sure such kind of participatory governance for conducting human subject research, that the engagement of investigator, how can we empower the research community by conducting high quality ethics review and with more support from the institutional level and also more engagement from the community, not only from the research community, but also from the public or the potential participant. That still would be very challenging. With that, I would like to close my presentation and save more time for discussion. Thank you.
Thank you so much, everyone. We've already got quite a few questions coming in from the audience. I'm going to kick off first, just with an observation that, of course, I mean, the research that each of you have touched on spans US, China, Latin America. I'm just thinking that in this increasingly globalized research landscape, how feasible is it for ethical principles and guidelines that are developed to be consistently applied across these different cultural, legal, and institutional contexts? And how is that diversity of jurisdiction and culture managed in human subject research? I'm not sure if anyone wants to jump in there. I mean, maybe there are some examples where this has been, you've seen some innovative examples where this is being done well, and some examples where it hasn't been done so well.
Well, I can start because I can think of a couple of scenarios in which kind of we're facing the question that you're asking, Sally, and Shana's research is definitely making me think of a couple of these, right? So, but one is where it's US funded research, but that is being done in another country, right? So predominantly, in theory, it should be governed by US protection standards, but there is something that gets altered based on where in the world the research is being done in terms of what is considered a fair default in terms of risks and benefits. How do we define risks and benefits, for example, in a country where they may not otherwise have any access to healthcare, right? So here we have certain protections that we need to make sure people understand their options when research and treatment overlap, right? So we want to test this. A comparative effectiveness research is a great example of this, right? There may be a couple different treatment options, right, that we want to test out which may be better. And so we may want to design an experiment where folks are given the different treatments. And then over time, we look at how each one works, right? Well, there are certain limits to that, right? So if we know, for example, that a certain kind of treatment is already considered good standard of care, we are not supposed to deprive somebody of that treatment in order to just get more information about, oh, well, what would happen if they got no treatment, for example? That's the kind of abuse that we saw back in the 1940s, 50s, 60s with Tuskegee in the US that led us to be more robust, right? Except that in other countries that are poorer and don't have the same access to healthcare, what is the standard we should be using, right, to determine what the default should be? If they wouldn't otherwise have access to care, but now we are introducing treatment into that society, do we have, and I would argue absolutely yes, an obligation to make sure that they have access to the same kind of treatment that we know is good standard of care, right, as part of the ethics of that study. Unfortunately, that has not always been the case, right? And so part of what we've seen in our evolution of requirements is something to kind of require us to be more ethical in terms of applying those same standards, right, to other countries. But it's definitely, there are definitely still gaps and there are challenges there. I think the other one that comes up, and Shana's research, I think, really highlights this as well, is what happens when you have different regulatory regimes that give you, maybe another country gives you more access, for example, to a kind of treatment that would be illegal here. What do we do with that, right? You know, again, part of, you know, what the challenge of Shana's research and why she has such headaches, I think, from the IRB, right, isn't because of anything inherently bad or sinister or untrustworthy at all about the IRB or the researchers or anything like that. It is our current legal system that has criminalized people using drugs, criminalized people who may have mental health issues and are using drugs that we have deemed illegal. That is what is creating all of these challenges. And so again, that's the piece that our rules don't really grapple with, is the other reality of the world in which the research is taking place.
I mean, this leads me to ask, back to your point before, Brie, about the necessity to consider justice holistically. I mean, what does that look like, and to what extent can researchers realistically be expected to kind of redress these inequities that obviously go much deeper than their field of study? And what I understood you to be saying was that this question of justice kind of, it bites at the level of the research and how the research is designed, not just in the distribution of the fruits of the research.
Absolutely, absolutely. It is definitely both. It is design and it is who's benefiting from the knowledge of the research. If I can just share really quickly one more time to answer your question, because so this slide, if you guys can see it, it says, "I won't be used as a guinea pig for white people," right? Quote from one of the folks in this community. The smaller subtext there, I don't know if you can read it, says, you know, mistrust of vaccines runs deep in African-American communities. Against formidable odds, Father Paul Abernathy and his teams are trying to convince residents of Pittsburgh's historic Black neighborhoods to volunteer for trials testing a COVID-19 shot. And so my answer is community engagement as part of design is crucial, right? Haihong mentioned the importance of community engagement toward the end of her presentation. I think, you know, Shana being embedded in the communities where she's working, to the extent we could have more kind of their participation, that could maybe help IRBs see this is actually community led. Now, again, I don't know kind of who that community would be, right, Shana, if it's people who have already, let's say, are peer workers who may have historically struggled with certain drug use and are now seen as still part of the community, but in a better position, let's say, right, to show lack of coercion, undue influence, and to want this. But this idea of community, the same thing here in terms of maternal health. So this sacred birth study, this is an example. It was started before COVID. We've had a real issue with challenges of maternal health care, and especially for Black women in the US. This was a research study that was co-designed and led not just by researchers who happened to be led by a Black woman doctor or researcher, but by patients, by Black communities that said, we need more information about this. But in order for us to trust this, we want to have a say in the design. We want to talk about the questions we think you should be asking that matter to us, instead of having somebody externally decide what they think is important. And more importantly, we want to be part of the process of reviewing results. We want to know we will get the results of this study and be able to use it to benefit our community. You'd be surprised how many communities have been the subject of studies and then they don't get the results. And they're feeling it. There's a lot of mistrust there. So I would say community engagement and participation is a place where we are seeing greater movement in the US to try to address these issues.
Shana, I wonder if you'd like to pick up there as to how you approach this question as an anthropologist in terms of designing your studies with, I imagine, with forms of community engagement and a kind of understanding of your positionality relative to the people you're studying. I'd love to hear more from you about that.
Absolutely. I mean, Bree brought up so many things. I'm writing all these notes about things I could say. I think one of the I'll start with sort of the thing that Bree started off with is with international research. I am somebody who doesn't research internationally. And one of the things that has changed, at least at the from when I started doing research internationally up until I would say the past 6 years, in my experience, has been that the IRB at my institution now requires that if you are going to be doing research outside of the US, regardless if it's funded by, US federal funds or foundation funds or self-funded, doesn't matter. If you're going through our institutional review board and you are doing research outside of the US with a human subject, you have to get a approval from basically an IRB equivalent outside in that country. And if that country does not have a formalized institutional review ethics committee process, then you can submit like a letter from somebody who is a researcher there, who does research with humans to attest to that fact. But I know that at least some IRBs in this country are saying, you know what, you can't just go to a different country and not comply by perhaps their legal requirements, let alone maybe some of the ethical concerns that they may have about foreign researchers coming in. But as Bree said, that isn't necessarily equivalent depending on where you go. And that I've had to negotiate as well is like, oh, I'm doing research in Mexico. How do I deal with that? I'm doing research in Argentina. How do I deal with that? Which I think is a very interesting question. And, like with Haihong talking about like China has this whole system in place, how does it align with, American or other non-Chinese researchers wanting to come in and do research? How do these different perhaps institutional or just national bodies maybe not align, or how they do align, which I think is a really interesting thing to think about, given the fact that so many people are doing research that is not just one place dependent. I think with my research, something with Bree bringing up this basically community-based participatory research in many places where a researcher or a research team will work with members of a community, whatever that is, to design projects, to perhaps determine what kinds of issues or concerns they may have, rather than the researcher coming in and saying, hey, we're going to be looking at, diabetes in this community, and this is what we're going to do, and this is what we're going to do, rather than having the community helping organize that project, but also raising their concerns or saying, we're not concerned about that as much as this. And that does create a different kind of relationship, but it does also, I think, raise questions about, what is our role as researchers in communities that where we want to do research, or maybe do research in order to help design a program or some kind of intervention. But unfortunately, a lot of these communities do have trust issues with researchers because they've been exploited or whatever in the past. For me, with people who use drugs, this is a big concern because because of a lot of vulnerabilities and because of legal criminalization, there are times when there are people who just do not want to participate in your research. And so trying to figure out, how can I convey to them that I will be protecting their data, but also data isn't going to be used down the line to hurt them. Because I think some people think, oh, you're doing a research about this, but are you going to be giving this to people who might be, creating policies or different kinds of programs that they may not benefit from, first of all, or might get criminalized for and therefore hurt more. And so I think that one of the things that I am always trying to deal with is, how do I create a level of trust as a researcher with the community that I'm working with, in order for them to feel like I'm not going to knowingly do harm to them with my research through the process as well as after. But one thing I will say about this, and I don't want to dominate this point here, but I think there's one thing about the ethical issues related to designing the research, and then the actual kind of data collection process, which has its own ethical issues, but the after effect, which Bree was, talking about who benefits from our research results, who benefits from the publication of different kinds of, articles, manuscripts, reports, but also the ethical issues of when we leave the field. And for me as a researcher, what have I perhaps raised certain issues for the people who I do research with through the very questions that I ask them? Am I re-traumatizing them, or am I bringing up problems that they don't, they're talking about because they feel comfortable talking to me, but I'm not a healthcare professional, I'm not a mental health professional. And am I just like, thank you so much, I really appreciate your time, and then all of a sudden leave. And now they're left with like, oh, maybe things came up that are hard for me to process, just because I do work with a population that often has a lot of co-occurring mental health concerns or disorders. So I think that when we're talking here about sort of the ethics, we're talking about, as I mentioned before, formal and informal, but we're also talking about there's ethics that are involved in getting the projects approved, doing the projects, and then sort of the after effects. And I think that all of those require perhaps their own set of questions and issues that we have to perhaps grapple with.
Thank you, Shana. There's lots I'd like to start unpicking there. I'm just conscious of the time, and we've got lots of questions building up in the chat. I'm going to try and group some of them together. A few questions are circling around this notion of informed consent and how meaningful it is, and whether or not the practice of informed consent measures up to the principle. So two sort of angles on this question. One, I think, would be the question of whether or not there's adequate attention paid to the way that consent is secured, the way the information is delivered, whether or not there's any psychological research about the necessity to frame the communication in a certain way. The other angle on this, which touches on something Haihong was talking about, which is the ethic, and of course you too, Shana, the ethics of data collection. And I'm just asking myself that in an era where we have, in the course of research, we assemble large data sets, somebody gives their permission for their data to be used for one particular outcome, but then that data set exists, and it may be that down the line, some artificially intelligent large model like finds things in the data. To what extent can one ever kind of consent to the possible uses of one's data, and does that pose a challenge as well? And I'm curious to hear from any of you on either of those points, or anything else to do with informed consent and whether it's fit for purpose. Haihong, maybe you'd like to jump in there from the Chinese perspective.
Thank you, Sunny. So, and actually, that would be one of the most interesting and important problem in our protecting the subjects, or how can we collect and use and share such data responsibly. Actually, in China, one of the, I think, most important lessons we learned from the past is previously we do not consider really thoughtfully about after the completion of this specific research, how can we deal with the research-related data? Can we store it or can we destroy it? So we have learned about these lessons. So far, according to the latest regulatory requirement, we make the consideration compulsory. Like when each research protocol come to our research committee, we will ask them, will you destroy the data or sample after the completion of the research, or are you going to store it? Where do you store it? And do you have any plan for possible data sharing or secondary use? We make the research team make plans and if necessary, make those resources needed in place. That is some kind of strategy we try to help our research community and institutions have better management or administration of such kind of sources. And another very great challenging is even though we required from the regulatory perspective, okay, we should disclose or we should specify such kind of detailed information. However, some future unspecified research is really out of our control. We could, all the research teams really could not know exactly what they would like to do. So we are considering maybe for the future, some kind of dynamic consent mechanisms might be endorsed to improve such kind of consent. However, informed consent is one of the necessary conditions. The consent requirement should work with other protections, like we make sure to avoid some kind of unnecessary or uninformative research. We try to make sure the institutions or the biospecimens, biobanks, or some kind of data repository are really qualified with their administrative mechanisms or even software or hardwares to make sure such kind of privacy protection and the data security. So it's kind of some kind of infrastructure development along with the ethics review mechanism and the consent to respect the data subject.
Interesting. Bri, I don't know if you had any follow-on thoughts on this question of informed consent.
Yeah, so informed consent is so interesting. So I teach it both in the context of medical practice, so physician-patient, ordinary relationship, as well as research. And certainly research regulations specify a few more things in the regulations that are required. But from what I have seen, neither one truly is focused on or provides like guidelines, safeguards, principles, or practical tools for ensuring true patient understanding in terms of informed consent. Both models are very unidirectional. They're very focused on what is the information that the physician or the researcher must provide to the person. And there's some language about it not being, too complicated or technical, right? But if you've ever seen these forms, I mean, they're massive. There's so much information. And it's almost as if our model has created incentives for physicians and researchers to try to comply and protect themselves by giving so much information that it actually undermines what we understand folks can handle. And I mean the most educated folks can handle, let alone those who may not have a formal education up to the college or graduate level, right? What we can really take in to comprehend and be able to understand at a moment in time, and how things are framed. Again, even for actually those of us who are the most educated are probably at greater risk of being able to rationalize away things and manipulate ourselves into believing things based on a framing that's given to us. We think we can kind of discern what is true and rational. But what I'm talking about goes beyond, like, educational background is one piece of it, but it really goes beyond that. It truly is about cognitive and psychological capacity that applies across the board. I don't care how much education you have. There are certain things we understand about what our cognitive load and what we can take, and what kind of framing will be most helpful for understanding or not. And there are tools for actually testing this. If we actually care about patient understanding, there is something called, for example, the teach back, that if you incorporate a method of asking the person who is supposed to be giving informed consent some basic questions to make sure they're understanding the key issues, and if they can't answer you back, that tells you there's been a disconnect in terms of what you tried to convey and what they understood. And I didn't learn about any of this in terms of anything I looked at with informed consent. I didn't learn about this until I researched health literacy. This is work that librarians have been doing. This is work that linguists have been doing, healthcare providers have been doing as part of, and some within the context of informed consent, but not because it was quite required by law, but in ways to try to truly facilitate better understanding of patients, to help them actually choose better when they thought that, quite frankly, patients would probably choose better than even what the physicians had incentive to recommend. So believe it or not, some of this research was actually inspired by ideas of reducing cost, reducing unnecessary overuse. But it was research, like I said, inspired by like cross-disciplinary and psychologists. And so if we really, really care about informed consent as a tool for ensuring true patient understanding and thus autonomy and agency, we would build in the expertise of psychologists and those who have more expertise in literacy and health literacy, and certain tools that they have developed and taught us are key for helping to ensure patient understand.
I mean, what I hear both you, Bri, and you, Haihong, to be saying is the notion of informed consent, instead of this model of kind of a one-off compliance, which is sort of like a rubber stamp. I mean, what you were talking about, Haihong, in terms of these notions of dynamic consent, it's really considering informed consent as part of a conversation and building in these feedback mechanisms so that we can understand that our conversation partner is genuinely participating in that conversation. I mean, whereas what you described, Bri, it sounds like we call it informed consent, but fundamentally it's about legal risk mitigation. So it's more about you stack all the information in, not because you actually really expect the person to be able to process it, but because you have to do that such that if anything goes wrong, you can at least say that it was there in the first place. So it sounds like, this would require a kind of fundamental rethinking of informed consent and a sort of baking in of these sort of practical checks in terms of, making sure that those feedback loops are being closed. I'm conscious that we've just got another 5 or so minutes and we've got so many questions. I apologize in advance. This is obviously a subject that people are very engaged with. I think I'm going to come back to this question of research ethics with vulnerable populations, particularly with regards to illegal activity, because I can see there's quite a few questions here. Maybe, a question for you here, Shana. We have a question about when you're working with people who are engaged in illegal activity, what sort of ethical challenges present in terms of needing to report crimes. And I guess this also relates to another question in the context of working with subpopulations. In the UK, this question would be called safeguarding. I'm not sure whether that term applies across contexts. But we have a question here about the challenges of working with children, for example, because of the necessity to disclose certain things to parents or authorities. And does this pose ethical dilemmas? And are there certain ways that we can support, or researchers can support, institutional review boards kind of understanding these ethical issues? So those are, I guess, 2 questions lumped into one in the interest of trying to pack in as much information as we can in these last few minutes.
Yeah, I mean, I can obviously speak to the illegal activity. I mean, I have not done research with children myself personally. It's obviously a huge area and a huge area of concern, especially what is being done in terms of the research with the children. Am I asking the child questions? Am I observing them? Am I doing like a medical intervention, right? So there's different levels, I think, when working with vulnerable populations like children or other people where, like, you know, where consent, giving any kind of level of consent might be difficult for them. So unfortunately, I have not worked with children, so I can't really personally speak to that. But in terms of like the illegal activity, and then there was another question in here I saw about like for people who might be, you know, under the influence of drugs when I'm doing research with them, right? Which is another huge thing that I have come across. I think this is constantly a struggle because of the fact that there is this sort of, there are certain legal obligations that you have to abide by, but then there's certain ones that the IRB tells you about. And then there's other legal things that I may be subject to that I have no idea actually are required of me because I've never been told, I've never been, I've never had to go through a training to tell me in these events you have to do these things. So for instance, if somebody is like, you know, doing something like a crime, I don't know, honestly, if I'm required to report those or not. Like legally, am I required to do that? Because I'm in the context of research. You know, like as a citizen, am I required to do this? Am I required to do it because I knowingly know something might happen? And there's been researchers in different fields who have, this question's been posed to them. I luckily have not been in a position where I've had to report something like that. However, there is something, at least in the US, and I don't know if this is in China or in other places, but for us, you can apply, and I always do this, and I do it, and I require my students to do it as well, who are researching, you know, illegal activity, is our National Institutes of Health have something that you can apply for called a certificate of confidentiality, which is an added level of legal protection, if you will, because it doesn't get rid of every legal thing that that one of your participants might be subject to if their data was somehow accessible, but it does have certain things in there for that your data can't be subpoenaed in certain circumstances, and you can apply for these, and if anybody can apply for them, whether or not they're funded through, you know, a national institute or not. And that's like another level of just legal things that you can have in place for protection of your participants, but it doesn't relieve the question on whether or not as a researcher, should I be doing certain kinds of things to protect my participants, but also the community at large. And I have not yet been in that position, but it is something that I know that people have had to grapple with. But I think it also speaks to the fact that when you are going through your human subjects research, and if you click that little box at my institution that says, yes, I'm going to be researching illegal activity, there's nothing in there that says, in the case of illegal activity, if you witness or know of this, this, and this, you were legally required to do this. So I have no idea if I'm supposed to do things in certain circumstances legally or not. Only if something happens in terms of the data breach, then they tell you what to do, but they don't tell you other kinds of things. You don't have to do some of those kinds of things, even though you do have to do an ethics training. They don't really go over that because it's much more general. It's not specific. Yeah.
You know, I'm also thinking here, I mean, in terms of what Bree's been talking about the fact that human subject research takes place within a society that's riven with inequalities and forms of oppression. I mean, logics of legality and its relationship to the carceral state. I mean, you know, you could actually say that ethically, if as a researcher your obligation is to push back against some of these hierarchies and forms of inequality, you wouldn't necessarily just have an obligation to report a crime, because the whole fact that certain communities are criminalized is part of the unjust set of circumstances that you're working within. I'm conscious that we're at the top of the hour, but I did just want to close with, I think, an interesting question from a participant about what can be done in relation to communities who have a rational distrust of human subject research based on past experiences, based on asymmetries of background knowledge. The suggestion here from one of the participants is to talk about compensation schemes to handle this problem. We've already spoken about community engagement, I think, as another lever for overcoming some of these hurdles of trust. But did the panel have any kind of parting reflections about strategies for overcoming rational community distrust of human subject research?
Yeah, I think I would just emphasize that community engagement should mean true partnership, as opposed to just treating them as subjects. Because engagement is kind of a mushy word, right? So I said it, I did say it, but I recognize that by itself, it doesn't really clarify what it means for a true kind of structural shift in power, right? That is essential to ensuring that a community can feel true ownership of what is being done. And look, I get this is a little tricky, right? Because researchers have the medical or psychological or anthropological expertise, right? They have the scientific expertise. Lawyers have faced this too, right? We have legal expertise, right? And we feel like we want to go in and we think we have the answer for how to help this community address this particular problem. But we all need to remember that communities are the experts in their lived experience, right? Communities are the experts in how they are being impacted by problems, how problems are manifesting, and most importantly, what their priorities are for their own health and well-being. And so I just think truly respecting them as partners and not thinking of them as subjects to be convinced, right, in all cases, but people to be both listened to and then to share knowledge, to help them understand and let them come to the decision, right, and respect it, right? And I think it's building that true partnership is the thing that I've been seeing as successful. Not necessarily easy, right? Human relationships are not necessarily easy, but important and meaningful.
I think that's a really important corrective and a very good note on which to end. I mean, what I hear you to be saying, Brie, is this, I guess, idea of co-creating research with communities, not simply what are the vehicles by which we can convince communities that this research is a good idea, but actually involving them in a holistic way and, you know, giving them a sense of agency over the research and recognizing that the researchers have something to learn from those communities too, that they're not just these kind of passive receptacles for whatever studies are going to be done. Well, look, thank you all for such a fascinating conversation. It's opened up lots of different avenues of inquiry, and I'm just conscious that we can't possibly analyze them all, but I think we have covered a huge amount of ground. And I think it's also, you know, given a very concrete sense of hopefulness about how some of these principles need to evolve, and it'll be very exciting to follow this space in the coming years. So thank you all again for today. Yes, I'll just actually reiterate what Shana has said here, which is if anyone has any questions, I'm sure the panel would very much welcome you contacting them to follow up. So thank you all very much for your engagement and time today. And thanks to the panelists for sharing your expertise and experience. It's been a real pleasure.
And thank you, Sally, and thanks to folks who are here and for your wonderful questions.
Yes, thank you, everybody, in all your time zones.
Thanks so much, everybody. Bye-bye.
Bye.
Thank you, bye-bye.